We're live on both.
All right, very funny. All right, good evening, everyone. This is Dr. Schilling with Secoya Health, bringing this week's Wednesday Wellness Minutes, and we're super excited to be with you this week. We're going to talk about neurofeedback, but before we do, I have a special announcement at the behest of my most trusty compañera here, Amelia. I want to bring everybody's attention to Active Participant Appreciation Week. If you can say that 5 times really fast, send us a video, we'll give you a prize. Active Participation Appreciation Week. Holy cow. All right, so that's going to be March 1st. We're going to do it from 1 to 6, all right? We're going to be having food. We're going to be having tests, samples, products, all kinds of fun stuff. We're going to have some vendors here. Check it out. Come in, bring your friends and family. Leading up to that, we're going to have a complimentary PMF for you and a friend. You can come in for a complimentary half-hour session if you bring a friend in with you. And that's going to be February 25th through the 28th. And she'd like me to remind you, you must schedule that ahead of time. You can't just pop in and say, hey, I'm here to do some PMF. So just wanted to let you know about that. A couple of housekeeping issues. And getting back to the task at hand. So we are super excited to bring you one of the best technologies I know of on the planet. It's called neurofeedback. If you've never heard of it, maybe you want to type in like a TED Talk, neurofeedback, type in YouTube, neurofeedback, something like that. I'm going to give you just a basic understanding this evening. We're not going to, this is like super nerdy stuff. Like, as you know, here we focus on everything. Healing starts in the brain. You can take a dump truck load of nutrition out from the back parking lot and shove it in your mouth, but it's never going to fix anything that is happening from your neck up. So whatever you put in your mouth is important, but if the problem's in your brain and you don't fix that, that's going to be a limitation for your health moving forward. To that end, here are just some highlights of what neurofeedback can do. And I'll tap into some of these a little bit more at length, but we understand that this can be beneficial for pretty much everybody who has a brain. So if you have a brain, neurofeedback's for you, okay? Good stuff. Anyone with PMS, autism spectrum disorders, ADHD, PTSD, sleep disorders, chronic pain. Think of this as all dysregulation in the brain. And you could try to do talk therapy, you can try to take a supplement, you can try to do a bunch of different things for your brain from here down, but unless you rewire your brain from here up, you're not going to get the long-lasting permanent effect you're looking for. And what's cool about this, if you couple neurofeedback with QNRT, you can go anywhere from what normally takes a neurofeedback session or set of sessions between 60 and 80 sessions. You can bring that down to 12 or 24 sessions when you marry it with QNRT, which is fantastic technology improvement. Anytime you can cut something in fifths and make it that much more effective and feel better about life and enjoy life more, what more could you want, right? So we'll probably show you down the road an example of what the setup looks like. It'll be a really comfy recliner, nice big TV. Basically what it is you're watching something and the computer is monitoring your brainwaves. You have electrodes on your head and it's picking up the waves and it's checking your delta and your gamma and your theta and your beta and all these brainwaves that it's putting off. And it's getting all nerdy, saying, okay, what's irregulated or what's dysregulated, what's high, what's low. If your eyes are open, what's happening? If you close your eyes, what's happening? Are theta and alpha jumping up when your eyes close and you're going into that meditative state? Or are they going spike, but then they're dropping and then your beta is going way high? So we don't need to get nerdy on this. Like, we're all learning about this right now. Carolyn, Amelia, and I, we're all studying this right now because we have Teresa Turner from the, I forget, is it Victory? Is that what it is? Victory. There you go, Victory Health, something or other. Anyway, Teresa Turner is a naturopathic doctor. She is the wife of John Turner, the inventor or discoverer rather, of QNRT. And we have acquired a system for quantum neural feedback therapy. So it's going to take it and put it on steroids, if you will. Cool, super cool. All right, I'm so excited, I'm getting dry mouth here. So basically what you want to understand is neurofeedback retrains your brain. It literally figures out what's out of balance, and while you're sitting there watching something pleasurable on the screen, it's actually monitoring, and it's going to change the lights, it's going to change the sound, there's some vibration feedback and a bunch of other stuff, there's different sounds it can use depending on what your brain needs. So basically it's like fine-tuning the most amazing piece of musical instrument using a computer, and it's helping you fine-tune your brain. So that's why it's so stinking amazing. There's just no limits to this technology. As we mentioned, the different brain waves, gamma's the super active, like super scattered energy, and beta's right below that. Alpha's what people think about in meditation, and the theta is also as well. Delta's when you're really, really deep sleep, and you're just checked out. That's really what it's about. So we can slow or reverse the cognitive decline. If people have Alzheimer's, think about Alzheimer's and Parkinson's. It's all brain degeneration. If you start seeing people like moving slower or slower to think about a thought or something like that, it's really brain degeneration. And neurofeedback can also help recover that. And if not slow it, it can stop it altogether. It's going to help people with attention issues, like their memory issues, like how much information they can retain. This is going to be a great therapy for anyone who's doing Learning RX or Brain Gym or any one of the systems around here, like Sylvan Learning Centers or Huntington Learning Centers. All these people can benefit from this because it's going to supercharge their learning ability. It's going to help shift your short-term memories into that long-term through the hippocampus and the amygdala and stuff like that. Let's see, improve your skills. So for example, athletes, they can actually improve their skills and their function. It's been shown after neurofeedback training, people can increase their accuracy as far as where they're placing their body movements and things like that. It's going to lower anxiety. It's going to help decrease the levels of depression by upregulating the positive brain waves and downregulating the ones that are slowing down. Like if you have way too much delta, like it's going to depress your brain. You're going to feel sluggish and slow and things like that. So all this can be helped with this. And we talked about sleep, ADHD, learning difficulties, developmental difficulties. Sometimes people come in and they have traumatic issues. So for example, let's just take someone who has autism. Like it's usually a combination. Remember, no one thing causes any one thing. So it's going to be toxicity, maybe trauma, neuroemotional stress, detoxability is low, things like that. You want to understand that all this stuff plays a role, but neurofeedback can be important in this. People who are recovering from stroke or PTSD, when they actually have a trauma to the brain, like TBIs, traumatic brain injuries, this is super helpful for, because what you want to understand is this can actually find the particular area of the brain where the trauma marker is, whether it's in the short-term or long-term traumas, in the occipital lobe and things like that, or in the frontal lobes, and you can determine what brainwaves need to be balanced in order for someone to not have that startle reflex if they're PTSD, or help upregulate the area of the brain that's been damaged due to what's called an infarct, or a death of the cells in the brain due to the stroke. Let's see. Addiction, people with addictive personalities, people with OCD issues can also be benefiting from this technology. Super cool stuff. Chronic fatigue syndrome, chronic pain syndrome, migraines. I mean, it's almost ridiculous when you think about how many people can benefit from this. Literally, if you have a brain, you're going to benefit from this. We're so excited to get trained on this because we're going to start training our own brains, and everybody can use a little bit of brain training, right? I mean, who doesn't want more out of life and be more efficient and things like that? People with fibromyalgia, people with weight gain challenges. If you understand the brain dictates your hormone levels, and what it's going to do is it's going to change how you're going about regulating your hormone cycles based on the brain. So awesome. Epileptic issues, people with seizures, people with cerebral palsy, schizophrenia. I mean, unbelievable. Tourette syndromes, tinnitus. I mean, let's just not get silly about it. This is just silly because there's no limit to this technology. If you have some dysregulation that you're not even sure what it is, like it smells like this, talks like this, and walks like this, you think it's a duck, might be quacking like a duck, it's not really a duck. It's a brain imbalance, right? If your elderly family members are having trouble moving, their speech is declining, their cognition is declining, or you want to improve your function, improve your sleep, improve all your hormone functions, this technology is fantastic. So let us know what condition you might be dealing with, what you've been labeled with, right? Hi, my name is, figure it out over here, okay? And you want to take that label off, throw it on the ground, and stomp on it because you don't want to live down to your symptoms anymore. You actually want to live up to your potential. Neurofeedback is going to be a great tool for you. All right, and remember, it doesn't. If you look up neurofeedback, it typically has issues of being scrutinized because it takes a long time. But when we couple it with the QNRT training of the brain, you have two inputs to the brain. You're totally going to revamp the brain. It's going to rewire itself. If you've ever heard of neuroplasticity is fantastic. It basically has, your brain has the ability to mold and shape. Even if you've had a stroke, your body can adapt new cells in one area to take over the control that was lost in another area. So your brain is amazing. So just remember that. If you ever get frustrated with it, just take a step back and say, oh, my brain's amazing. You just got to figure out what's going on and why it's not working. Okay? Is it toxicity? Is it an infection? Does it need to be trained? Whatever it is. We can help you find that answer to that mystery for you, because things don't have to be a mystery. When you employ the tools we have, things are no longer a mystery. There is a solution for what you have. If it doesn't need to be cut out of you, if they don't need to put plates and pins and screws in you, we can usually fix that. So let us know how we can help you. Share this with your friends and family. Do us a favor and help us. Our goal, our big, hairy, audacious goal, that's called BHAG, if you ever heard of that before, is to touch the lives of 1 million people by 2029. Now, we'd like to do it a lot sooner than that, and the more you can help us, the more you can do us a favor by sharing this with your family, helping them reach out to us for help with their issues. That is our goal, is to help as many people on the planet. If we could touch 8 billion people's lives, even the more better. But we're going to start off with an incremental goal. We're going to go with 1 million by 2029. So that means we're going to have to get help from you to get more people to learn about what we do and the tools we have to help them, so that more people can help themselves, educate themselves, and be empowered. All right, guys? We look forward to seeing you next Wednesday. Let us know what we can speak about and provide you information on. If you have questions about neurofeedback or any other therapy we have at the clinic here, let us know. We're happy to help you get that information, and we're just here to help you. We're here to serve you. So let us know how we can do that, and let us know what information you want, what condition you might want us to talk about. Next week, we're going to be talking about intravertebral discs. People often have questions about IV. Well, just call them discs, right? You have vertebrae and you have in between them, they have discs, okay? They're like a squishy thing. We'll talk about that next week, because a woman had commented on one of our previous posts about talking about discs and why people have breakdown, and we'll be able to talk about why the neck breaks down, or why the mid-back breaks down, or why the low back, and things like that outside of trauma. If you don't have a trauma to your body, like you haven't like fallen out of a car and landed on your head like an accordion and then had your vertebrae smashed and things like that, and your discs shoot out the sides, then your body's breaking down on the inside before it breaks down on the outside. So understand that if there's something in there like Pac-Man munching on your disc and causing irritation and weakness, we can find out the root cause of that and help you overcome it so it doesn't tear down the rest of your spine. Does that make sense? All right, sweet. So share this with your friends and family. We're excited to help you guys grow on your path, and we will look forward to seeing you next week for the Wednesday Wellness Minute. All right, guys, take care. Bye-bye.